Dr. Nate here at Thrive Dental Orthodontics, and let's talk about retainers and how long you need to wear retainers. And then I'm also going to go through the top 3 retainer choices you likely have. All right, you went to this video because you want to know how long you need to wear retainers for. And the basic idea is you want to wear retainers as long as you want your teeth straight. That's right, retainers are pretty much a lifelong commitment, but it gets less and less committal the further and further away you get from getting the braces off. So let's go through it. This is how I tell all my patients to wear the retainers. For the first 3 months, this is the most important time. You want to wear those retainers 24/7. That means day and night, all the time. You're basically just taking them off to drink, eat, brush, and floss. Other than that, they're on there because the teeth are the most mobile at this stage. After the first 3 months, you're gonna go down to nighttime only, and for me, that's like 12 to 14 hours. So you're gonna do that for 2 more years, okay? So after those first 3 months, then you move just to nighttime only, 12 to 14 hours, but you wanna do that every single night. Every single night, you do not want those teeth to shift. The first 2 years are when the teeth are shifting the most. The first, like actually 3 to 4 to 5 months is when they're actually shifting the most, but the first few years is when everything's starting to really solidify and get into place. What do you do after those 2 years? You don't just throw away your retainers. I've heard that has actually been done before, probably by orthodontists who want you to come back, but you do not throw away your retainers because retainers are a lifelong commitment. So how do I do it? After those 2 years, I basically just want you to wear your retainers maybe a few nights a week forever, ever, right? You're gonna wear those forever. So remember, for the first 3 months, all the time, 24/7. Next 2 years, every single night, 12 to 14 hours. After those 2 years, and you're gonna wear them like 1 or 2 nights a week, but forever, ever. All right, so now you know how much you have to wear your retainers. You know they're a lifelong commitment. What are your 3 options for retainers that we offer here at our office and most offices? Number 1, the one that we offer the least amount that almost nobody takes, is something called a Holly retainer. A Holly retainer is those ones you've probably seen on the videos where people have that metal piece in front on the top and bottom teeth, and they have this like clear, big, thick, and sometimes it's red acrylic on the back side, and that keeps the teeth in there nice and solid. The reason we don't use these as much, number 1, for aesthetics, people just don't like the look of it most of the time. Also, it doesn't really encompass the whole tooth. You know, it pushes on the back with acrylic and on the front with the metal, but it doesn't encompass the whole tooth, and so that is why we tend not to use those quite as much. The second one, the one that we use not quite as much as well, but this is the second most popular, that is called a permanent retainer. Most of the time people will have a permanent retainer on the back side of the lower teeth. Some people do it on the back side of the top teeth. I don't do those as much because they break off so much, because think about this. If it goes on the back side of the teeth, if your bite is basically perfect, or as good as perfect as you can possibly get it, when you're biting down, no big deal. The back side of those lower teeth aren't gonna hit anything, all good. But if you put on the back side of those top teeth, if your bite's really, really good, you're gonna hit that thing and eventually it's gonna come off. If you don't have a removable retainer or something else to keep those teeth straight, your teeth will absolutely get crooked again. The other disadvantage of a permanent retainer is it's just really hard to keep clean, and sometimes they break more frequently than a removable retainer. That being said, I still think permanent retainers are a great option for people who aren't responsible enough to wear a removable retainer, so that is the second most common type of retainer we offer here. Third retainer, and this is the one that we use for pretty much like 95% of the patients, that is a clear Essex or suck down type retainer. These retainers look a lot like an Invisalign tray, just a little bit thicker, and we can make them in the office and they can be ready pretty much that day or the next day, and that's why I love these so much. Because as soon as you get your braces off, I want to get you in retainers ASAP. I don't want to take your braces off and like 1, 2, 3, 4 weeks goes by and then you get a retainer. Because your teeth, like I mentioned already, are the most mobile or most shifty within the first few months. So we want to get the retainer for you as soon as possible. The Clear Essex retainer is clear, as you guessed it. So you just put it on, and same thing, you want to wear this 24/7 for the first 3 months, nights for 2 years, and then periodically after that, forever, ever. All right, now you know how long and how much you need to wear those retainers. You know the 3 most common types of retainers. Maybe you're still in braces, not quite at retainer stage just yet, and you're trying to ask, hey, Dr. Nate, how do I know if I'm done with braces? Luckily, I have a video for you that is gonna go through the things I look for in order to determine if a patient is done with braces. Once again, thank you so much for watching this video. If you have any questions or comments, please let me know, and I will do my best to try to respond as best as possible. But if you want to get out of braces and you want to know exactly how or what we're looking for, check out this video, and I will see you in the next video.